Thank you. Thank you, everybody, for coming. And thank you for Core Foundation for inviting me. My name is Dr. Avi Charlton. I'm going to introduce Andrew, who is the boss of Core Foundation, and the other boss who couldn't make it, Regan. And then we've got Kaylee, who's a coach.
Hi, guys.
Who works with Menopause, and we're going to have Kaylee to do a talk after, and we're going to do Q&As afterwards. So save the question to the last, and then we'll see if we can answer all the questions for you. There's food at the end. I've got some books you can buy that I authored and got some people who help me write. So hopefully you're going to learn a bit about menopause and metabolic health and how me and Core Foundation can work to help you through this journey. So just to let you know, I'm perimenopause as well. So I'm going through it all together with you. So thank you for having me, Core Foundation, again. And we've worked together for just over a year. A bit of a journey coming to Core Foundation once every 4 weeks to consult. And I am a member. I pay to train once a fortnight. And I'll show you what I do. And I pay for the CFX program. So we'll show you what the CFX program is in a minute. So a lot of us, in fact, all of us are female, apart from Andrew.
Token male.
You need to know about this stuff anyway.
Yes.
Yeah.
So I wonder, who feels hormonal? Who's perimenopause or menopause or feels hormonal all the time? Who feels tired all the time and want to have more energy? Who wants to lose some weight or just a little bit or maintain healthy weight? And burnt out. Thank you for 2 hands. And aches and pains, inflammation, that want to improve on their general health. So what happened was the journey of menopause is a bit of a winding journey. Back in 2002, this happened and menopause was never the same. Everyone goes through menopause. In fact, 51% of the population goes through menopause at some stage. But this happened back in 2002. This study called the Women's Health Initiative study came out and scared everybody that menopause is dangerous. The hormones are dangerous, may be causing breast cancer. So there's a lot of problems with this Women's Health Initiative that was published in year 2002. The study was just flawed. There's lots of problems with this study, and we now come to analyze this study that there's a lot of problems. The study was done on older women, over 70-year-olds. A lot of these women are overweight and they're smokers, and they used the wrong type of hormones. The hormones they used was horse urine and not body identical hormones that we prescribe now. And all the results was lumped together, combined HRT and progesterone HRT and estrogen HRT. They're all lumped together. So the data, it's actually quite wrong. The risk was not quite right. And they stopped the study early because they were scared of this increased risk of breast cancer. And the risk of heart attacks was also not quite right, misinterpreted. So we really need to not worry about what this study shows. And there's lots of information debunking that this study has got lots and lots of problems. So this menopause that everyone will go through, and hopefully you do go through menopause, because otherwise you die. Because if you don't go through menopause, you die at 48 or 49. So everyone that's over 50 and 51 will go through menopause because we don't want you to die. And it's been cancelled. Nobody wants to talk about menopause. Doctors stopped learning about menopause. Doctors stopped prescribing menopause hormone therapy or HRT. And it's become a taboo that we don't want to talk about it. This is last year in March 2025. I went to Sydney in pursuit of learning more about menopause. this conference in the Opera House called So Hot Right Now. It was jam-packed in the Opera House with thousands and thousands of women wanting to learn about menopause. We all want to learn now. Everyone wants to talk about menopause because for 20 years we haven't been talking about menopause. So I was with all these women, I think about 5,000 women, jammed-packed in the Opera House. And I've become passionate about menopause. So just to introduce myself about what I am, I'm a GP of 20 years. I've been practicing in Montana, doing normal general practice, prescribing coughs and colds and antibiotics for 20 years. And I did some learning about 5 years ago, learning about nutrition, and obesity management, learning about low carb, nutrition network, and I did some breathwork education as well. So I've become really passionate about prescribing lifestyle and natural therapies, and learning about menopause has just become the next thing to learn other than nutrition, lifestyle, and now I am passionate about learning HRT, menopause as well. So about 3.5 years ago, from becoming a normal GP, I decided that I'm going to set up Melbourne Low Carb Clinic because I think this low carb message needs to be told. Talking about lifestyle, nutrition. So I decided that I'm going to become a specialist GP clinic. It's a little niche clinic to talk about lifestyle, talking about nutrition, and the consultations become a bit longer, become 45 minutes instead of 10 minutes in and out, bulk billing, and it's become paid because paid consultations, people are more motivated to learn about nutrition. So this is in Montana, and now I've spread out to Pascoe Vale, Canterbury, and now in Beaumaris as well. Once every 4 weeks, I come out to consult in the little room down there. And you can book in to see me. We talk about menopause, nutrition, and lifestyle. And I help people lose weight, help people go on HRT. So that's my little journey. And through this lifestyle clinic, people lose weight. Like a couple of, hi Catherine. Someone lost 20 kilos in 3 months. And people get HRT and they feel much better. They get less hot flushes, they get more hormones. And these consultations are so rewarding. So I'm so passionate about how I can improve people's lifestyle. And through working with Core Foundation, we can work to improve everyone's health. So this is me working here and doing home workouts. So that's me and my dog playing the CFX program with Andrew talking at me for 20 minutes. And I run as well. Through the last year of training using the Core Foundation program, I come here every fortnight because I live in Don Vale. I drive 45 minutes to come here to train for an hour. I feel a bit crazy sometimes. So 45 minutes coming from Don Vale to here, 45 minutes going back. And then twice a week, I use the CFX program at home. And it's been rewarding. My running times have improved. I feel stronger. I feel my glutes are activating a bit more. So we'll talk about how we can use this program in a minute. So this is just very recent. This is RFK Jr. in America. He has removed the black box warning in HRT. We are now really thinking hormone therapy is very, very safe. There's vaginal estrogen, there's HRT in terms of topical estrogen, progesterone, testosterone. We really think these hormone therapy does not increase the risk of cancer. So we're coming out to really prescribe HRT. If your doctor is still not keen on prescribing HRT, there are so many doctors which are educated, including myself, to be really passionate about hormones. So this is my framework of managing menopause is HRT, or we also call it MHT, menopause hormone therapy, and I talk about lifestyle medicine. So I like to use both of these modalities to help with menopausal health. So if you come in to see me, you get individualized medical advice. This talk is not individualized. It does not constitute any formal medical advice, just to caveat that don't quote me for individual medical advice. So I like this slide because this woman is strong and the other woman looks like a typical 74-year-old. So who would you like to be? The woman on the left?
Yeah.
Or the woman in the right using a walking stick? So she must think she's okay and she's just like any other 74-year-old, or she looks more 80 to me. Yeah. So hopefully I can inspire you to be lifting kettlebell weights when you're 74. This is the statistics, is the current life expectancy. We're living very long. The average life expectancy, we're in the 80s, 83. But the health span is, on average, only 71. So, on average, 12 years of living in poor health, which is quite scary. 12 years of maybe walking stick, or maybe you're weak, maybe you can't get up. Whereas I want to be walking my dogs at 83. And these are the type of common chronic diseases that we're facing. Alzheimer's disease, arthritis, cancer. Alzheimer's disease is going to be the #1 killer. It's creeping up. Kidney disease, liver disease. So liver disease is getting worse and worse. The usual doctor sees the abnormal liver function test, just says it's probably fatty liver, there's not much you can do, it doesn't matter. But it is a precursor for diabetes. It is a marker for early poor metabolic health. So if you go and get your bloods done, your liver's not quite right, it is a warning sign. Diabetes is being very much normalized. So there is pre-diabetes and there's diabetes. I'm hoping that I can inspire you to do a blood test to check pre-diabetes before it becomes diabetes. Your body screams for 5 to 10 years at a pre-diabetic stage before you become diabetic. Heart disease, a lot of scared about cholesterol. We're now thinking it's not just because of high cholesterol, it's because of inflammation. It could be sugars, processed foods, stress, inflammation, or increasing the risk of heart attacks, heart disease. Mental health disorders is getting worse and worse. Teenagers, young adults, it is related to inflammation as well, not just because of poor circumstances or sadness or anxiety. And obesity is just getting worse and worse as well. Hello, welcome. So this is menopause. When you're in your pre-menopause, your periods come regular. Your hormones are up and down according to your cycles. When you're going through perimenopause, your hormones are all over the place. And this period can be 2 years, can be 5 years, can be up to 10 years. Your period go all over the place. Some women can actually go through perimenopause in their late 30s. We're now understanding when your hormones going up and down, you can get brain fog, night sweats, dry vagina, hot flushes, even inflammation, aches and pains, shoulder pains, so common. When you go through menopause, you stop having periods altogether. So menopause is just one day defined as not having periods for 12 months. And then post-menopause, a lot of people still have symptoms post-menopause, and then some women have menopausal symptoms up to their 60s or even 70s. we are prescribing hormone therapy for older women as well. There's no oldest age that we can't prescribe hormones. So even though you could be in your 60s or 70s, maybe there's a place of hormone therapy. It needs to be individualized. So all these symptoms, women suffer for menopause. Brain fog, memory problems, aches and pains, joint pains, nervousness. Some women just says, I'm just not myself. I've lost myself. Some women say, just don't have any motivation and inflammation, bloatiness, or they say, I keep doing what I'm doing and I just can't lose the weight. Who's heard of that? Who thinks that is their case? Or mood or anxiety, or they just can't sleep well. So these are all menopause symptoms, and there might be a place for hormone therapy. Maybe we need to tweak your lifestyle, maybe a bit of both. So I like to talk about both. So there's 3 hormones we like to talk about with menopause: estrogen, progesterone, and testosterone. When you are perimenopause, your estrogen goes up and down. When you are postmenopause, your estrogen wears out and run out. So, so you can get hot flashes, night sweats, irregular periods, vaginal dryness, low libido, brain fog, tiredness. And then progesterone is the other hormone that counteracts the estrogen. You might get irregular periods, spotting, sleep is a big thing. So if you poor sleep, maybe you're lacking in progesterone. Anxiety is another thing that you might be lacking in progesterone. So we can talk about HRT in terms of estrogen and progesterone. And testosterone. People think it's a male hormone, but females have testosterone as well. And as you go through menopause, testosterone quite often goes down as well. And quite often, typically, is low libido, just don't feel like it. And your husbands might wonder why and then don't understand, but it could be their testosterone. Testosterone also helps with muscle health and muscle strength, motivation, mood, brain health as well.
Maybe we should run this for the husbands.
Well, the metabolic health is important for them as well, and a lot of these lifestyle things can help with their testosterone as well. And they often improve much quicker than the female counterpart. And doing this all together with them, sometimes you don't have to tell them, will help with their testosterone as well. So all these chronic diseases that increases with menopause, you've got high chance of heart disease, osteoporosis, osteopenia, diabetes, dementia, arthritis, mood disorders, obesity, autoimmune, urogenital syndrome of menopause, just means dry vagina, and skin aging. So we all don't like all of this, and maybe there's a place for HRT and lifestyle to improve all of these chronic conditions. So again, I talk about menopause treatment in terms of prescribing HRT if you are appropriate, and I talk about eating good nutrition, stress management, prioritizing your sleep, and strength training with core foundation. So we'll go through each of these in detail on how we can improve your menopausal health and age nicely, age gracefully. Again, HRT, I'm very passionate and I feel like I'm dishing out HRT. I'm on gel and I take prometrium tablet as well. I haven't got myself into testosterone, maybe in the future. But I feel like my strength is better, I'm running better, and less night sweats, less hot flushes, brain health is good. So that's just my personal journey. So benefits of HRT is certainly helps with your symptoms, but not just help with your symptoms, might help to reduce your heart attack risk, might help you improve your bone health. Treatment for osteoporosis is really more and more evidence that HRT helps with your bone health, build more bones, reduce your risk of breaking bones, improves aches and pains, reduce arthritis, improve your insulin resistance and reduce your risk of diabetes. Might help to lose weight, maybe, because that might help to improve insulin resistance. Might help with your mental health, reduce anxiety, maybe help with cancer, still to be found out. So this is the HRT that we used to prescribe and now prescribe. The Premarin and Prevera are very, very old. You can see the picture. That's like 30 years old. That's what my mum was on. But I stopped her back in the Women's Health Initiative days that it just was so scared. Mum, don't take it anymore. 20 years later, I'm on it myself. This is what I'm on is the Estrogel and Prometrium. It's a topical estrogen. These are body identical. So we're thinking they're very, very safe. You can also be on a patch like Estradot or Estroderm. Ovestin comes in pessary, and a cream is for vaginal dryness. And quite often, even if you don't go on the topical estrogen and progesterone, you can still go on the vaginal estrogen. Might help with reducing urine infections, might help with having intercourse, less dry, and some people are very sore down there, so it can help a lot. So again, this is what I work on, and if you read my book, these are the 6 pillars of lifestyle medicine that I like to have a framework. Nutrition, movement, strength training, exercise, sleep management, stress management, understanding addictions. So I'm going to go into each of these pillars in detail. So who thinks you're eating healthy? Who follows the food pyramid? Who thinks the food pyramid doesn't work? I'm glad that a lot of you know about the food pyramid. Has got a lot of problems. The food pyramid is for the whole population, especially those who are metabolically healthy, which is my 15 and 17-year-old who play sports and they are very active and who's got no fat. So I think many of us, especially now that we're heading perimenopause, menopause, we just can't do what we used to do and need to be tweaked. So here's my framework is we really need to think about protein because protein helps us build muscle and bones and helps with hormones. So when you plan a meal, first think about protein in the meal, which is meat, eggs, chicken, fish. And if you're vegetarian, vegan, tofu, legumes have still got lots of protein, and even yogurt, dairy has protein as well. So when you plan a meal, think about protein every meal. Most people don't eat enough protein. If you're eating toast and porridge and cereal for breakfast, that's not protein. So 3 meals a day, eat protein, meat, eggs, chicken, fish. And add healthy fat. A lot of us worry about eating fat because we've been born in the low-fat era. We worry about fat makes us fat. But in fact, we really need healthy fat. The healthy fat is, even the fat around the meat is great. Yogurt, olive oil, nuts and seeds, avocado, most people are happy to eat. Cheese, peanut butter. But stay away from the not healthy fat like trans fat, vegetable oil, canola oil, sunflower oil. So just be careful with those. And deep fried as well. So understanding your carb tolerance is really important. As I said, we're not 15-year-old boys that play sports and have no fat, no insulin resistance. We might not be able to do what we used to do. So if you can't have a lot of carbs, then the carbs is not your friend because they just go and store in your belly as belly fat. And if you're going to eat carbs, make sure they are good carbs, like real food. Vegetables, pumpkin, carrots, berries, a little bit of fruit. Too much fruit can be too much sugar as well, fructose. So just understanding all carbohydrates become sugar. So all your bread, potato, pasta are just sugar. So depending on how active you are, if you go running for 10 kilometers after a meal, maybe sure, you can have a bowl of pasta. Maybe if you go for a walk after each meal, maybe a bowl of cereal would be fine, but a lot of us aren't as active as we can. So just minimizing carbs, and I can get blood tests to check how metabolic healthy you are, especially this blood test called fasting insulin. So just a quick hormone 101. Insulin is the hormone that your pancreas makes. It ships the glucose to become fat. Every time you're eating glucose in terms of carbohydrates and food, your body makes insulin to ship it to become fat. If you keep eating frequently, which includes snacks and that milk coffee that you have 2 or 3 times in between a meal, is causing an insulin rise. So some people have a latte 2 or 3 times a day. Those are snacks. So some people have muesli bar in between a meal. Some people have a fruit snack in between a meal. Every time you eat, your body makes insulin. And if you eat 5 meals a day, which is very, very frequent, including those milk and muesli bars and fruit in between meals, then your body has to make insulin. So if we work insulin too hard, then your body has to make more and more insulin, and you might become insulin resistant. Your body doesn't manage to listen to this insulin. So back in those days, I have an analogy, back in those days that when my kids was nagging, "Mummy, mummy, mummy," then I just tune out. I can't listen to all these mummy and just don't talk to me nagging mummy anymore. So just like your body, if you have too much insulin, the body just does not listen to this insulin anymore, and your body will make more and more insulin, just like your child will scream, "Mommy, mommy, mommy," louder to get your attention. So thankfully, a lot of us are not having little kids anymore. So I check for fasting insulin. I check for this diabetes test called hemoglobin A1C. And if we detect that your blood glucose is slowly rising, then we can do something about it way before you become diabetic. So that's how I check for metabolic health.
Is that a different blood test to when you just normally have your normal blood?
Yes.
Okay.
So fasting insulin is usually not included in most of your GP blood tests, unless you ask specifically for your GP to do it, and they may or may not do it because they're not taught how to do it. But if you come and see me, I would do a fasting insulin, and I will incorporate your cholesterol profile, HbA1c, fasting glucose, all into a big picture, and your goals, and if you need to lose weight. So no, it is not a usual blood test that your GP will organise for you, unless they've got special training. So key nutrition tips is know your carbohydrate tolerance. Don't eat very frequent. 3 meals a day is enough, or 2 meals a day is good as well. Intermittent fasting may be helpful depending on your circumstances. Stop fearing fat. Don't do low fat. Have some fat, good healthy fat. Make sure you eat lots of protein. Stay away from processed foods and sugars at least, and maybe some blood tests personalized to your condition. So that's number 1 pillar. Number 2 pillar is movement and exercise. It's important. We need to train our body. We need to move. We need to strength train, build muscles. So here's me again working here once a fortnight, driving 45 minutes each trip. And that's me working at home. We're using the CFX program. 20 minutes twice a week. That's what I'm doing at the moment, which is working fantastic because my running is getting better. And I feel stronger. And we're going to talk about how CORE can help you, which I have no financial ties with, but just a friendship. Sleep is important. We need to prioritize our sleep. So I like to talk about circadian rhythm, going to bed same time every night, waking up same time every morning, and getting outside, exposing your eyes to sunlight is really important. Consistency is important. A lot of us don't prioritize our health because we might have kids and teenagers, or want some me time, or scroll on the phone, and that's actually quite detrimental. So making sure you have regular sleep hours, waking up at the same time is really important. So the sleep-wake cycle, getting outside first thing in the morning, getting out, exercising, going for walks. If you're going to nap, make sure your naps is short so it doesn't affect your sleep. Avoiding caffeine. I avoid caffeine from midday onwards. Avoiding electronics in bed, so try not to scroll in bed. And building a consistent sleep schedule, same time, going to bed, waking up, same time every morning. That's good circadian rhythm. It helps with metabolic health, and I think that's really part of the pillars of lifestyle on how to manage your health. So stress management is another pillar, and a lot of people say, I can't stop stress because things happen to me. Maybe someone died, maybe a teenager is causing trouble. A lot of people say, I can't help it. But the more you practice, the more you can manage your stress. So who feels stressed sometimes? I do as well, and the more I practice managing stress, the more I feel like I can do it when times are stressful. So meditation is just carving out some time, maybe 5 minutes to practice mindfulness. There's no perfection. People say, oh, I can't clear my mind, I just can't do meditation. It doesn't matter, it's a practice. So if your mind wanders off thinking about shopping list, it doesn't matter, the practice is bringing back, listening to your breathing, maybe listening to the fridge go hum, and that's just paying attention to what's happening here and now rather than worrying about the shopping list. There are apps that you can do, and I use Insight Timer. It is free, and you can just play a mindful meditation, you can play some music, even it's 5 minutes, even 1 minute is great. Mindfulness is just worrying about here and now, so I'm just worrying about this talk rather than what my teen is wanting me to pick him up at 3 o'clock. There's always something to pick up. And practicing gratefulness. I've started doing this about 1 year ago, doing a grateful journal when I'm in bed. So I just have a notebook and a pen, and I write down 3 things I'm grateful for during the day that's happened. So I scan what's happened in that day, and I write 3 things that I'm grateful for. It even doesn't take 1 minute, and I'm just thinking about positive things. Then I feel like I'm happy when I go to bed because I've thought about what's done well, what I've done well. Breathwork is another thing that I really like to do. Sometimes it's 5 minutes, sometimes on a weekend it's 10 minutes, 20 minutes. The Insight Timer has lots of breathwork. And even if you don't use an app, you can just pay attention to your breathing. A quick tip is breathe in for 5 counts, breathe out for 5 counts. Doing it for 5 minutes, 3 times a day is awesome. 2 times a day is good. Once a day is fantastic. Even if you do 1 minute, breathe in for 5 counts, breathe out for 5 counts, is just going to calm your nerves. If you're driving, you can just do breathe in for 5, breathe out for 5, and not worry about the shopping list. Healthy relationships is important, so get rid of toxic people. I'm going to share with you, I got rid of my toxic husband about 4 months ago, and I've never been happier, and I'm going to attract good relationships from now on. My teenagers don't need my toxic husband. So, and there are statistics that menopause is the transition that a lot of divorces happen because we don't put up with anymore, crap. So yeah, healthy relationship is really important. And addictions, avoiding substances. So many of us know cigarettes, alcohol are not great, but some of us, sugar and processed foods is an addiction. Sometimes labeling sugar addiction is really important to just label it, and you can't really go back to sugar and processed foods. So we can talk about that if that might be you. And but if you're alcoholic, you don't have a little bit of alcohol. If you're a sugarholic, please don't have a little bit of sugar. So it might be just a part of the treatment. So again, this is my lifestyle medicine pillar, 6 pillars working on all those 6 things. And if you're menopausal, maybe hormones that might be of use. So maybe we need to think about the menopause, HRT, MHT, as well as the other 6 pillars that I like to talk about. Then you can be vibrant and healthy and age well, just like these women that I just randomly picked from online pictures. So my mission is to empower women to create vibrant health by prescribing lifestyle. I have a podcast called Prescribing Lifestyle. My book is called Prescribing Lifestyle. And there's other things that, so 5 steps to create vibrant health is we need to understand our hormones, and hopefully this talk can help you understand a bit more, and we'll do some Q&As a bit later if you have any questions. Check your metabolic health, so doing blood tests targeted to you, checking insulin, checking cholesterol profile, and just as a I check cholesterol a little bit differently than your usual GP. I don't worry about high cholesterol because looking at triglyceride and HDL ratio is much more important. And I look at the whole picture rather than high total cholesterol. So please come and see me if your doctor is scaring you about high cholesterol. And starting lifestyle foundations, prioritizing your nutrition, strength training, managing your stress, managing your sleep. And maybe we can discuss HRT or MHT, and building lifestyle long-lasting habits is what I'm passionate to talk about. If you slip, you just get back on track, and many of us slip and maybe we go on a holiday, and but you just have to get back on track. So I'm going to talk about what we're going to offer, what Core Foundation has to offer. Again, I don't have any monetary benefits to this, but this CFX community I've joined since last September, since they've launched this program. And we're going to have this menopause community as part of the CFX community. And I'm doing this as a volunteer in the menopause community with Coach Kaylee, and Kaylee will going to come and talk a bit about this as well. We're going to have this menopause community within the CFX community to help women with menopause, to talk about hormones, talk about nutrition, and the plan is we're going to have some lives and Q&As once a fortnight, and there's interactions. You can go on this community to ask me and Kaylee questions about menopause and nutrition and how to prioritize lifestyle. Apart from the menopause community, there's the main program, which is the CFX platform with all the workouts that they have recorded, which I'm finding it's so helpful. And again, I do it twice a week for 20 minutes each week, most weeks, not every week. So this is what Core Foundation has to offer, and I'll get Kaylee to come and talk a bit about as well. How about Kaylee, you come and talk?
Yeah, of course. Hi guys. So yes, my name's Kaylee. I'm one of the female coaches here, and I specialize in women's health. Try me over this side. Yeah. I work with a lot of women that go through these menopausal changes. So this community is brand new. It's brand spanking new for everybody. So it's really exciting for us all to get involved with. We're going to be around to answer any questions. Basically, yeah, we're just going to give nutrition tips. We've got lots of different workouts on there. We do have a special offer for anybody wanting to sign up to that today. We will give you it's a lifetime sign up, I'm pretty sure, isn't it, Andrew? Yeah, for $297. This is the QR code if you want to just get your phone out and do that straight away. If you want to just come and speak to us individually about it, you can do that as well. We also have another offer for anybody that wants to sign up today. We'll give you an initial consultation with 3 sessions for, is that $199? Andrew.
Yes.
Thank you. Yes. So that, yes, there we go. Thank you so much. So that is the offer that we have for anybody who wants to get started with that today as well. So I guess it's time now to open up the room for questions, or have you still got a little bit more you want to go through?
Just a bit about what I do is
Yep.
I have 3 books which you can buy afterwards. I have a podcast called Prescribing Lifestyle, which is absolutely free. It's about 120 episodes that you can go to Spotify, YouTube, and Apple Podcasts, and lots of podcast platforms to listen to me talking about lifestyle. Regan was on one of the podcasts, Regan, the other owner of Core Foundation. So you can go and listen to Regan and me talk about the benefits of all this strength training with Core. And you can book in to see me as consultations here in Beaumaris once a 4 weeks if you like. So that's what I do. And so this is where I go to now is Wantirna, Pascoe Vale, Beaumaris and Canterbury. Great. So yeah, so we'll do some Q&A with Kaylee.
Yeah. Does anybody have any questions about what we do here, what we do differently to other